is absolutely critical to protecting you from severe illness from this virus and its variants. Today we are 15 days into the 30-day state of emergency, which we declared in order to combat the surge of the COVID-19 Omicron variant. Over the past couple of weeks, we have taken a number of urgent short-term actions to address the rapid rise in case rates, positivity rates, and hospitalizations, and in order to support our hospital workforce. I'm pleased to report today that all of the current data is showing very encouraging trends, with many of our key health metrics consistently and substantially declining. COVID-19 cases in Maryland are decreasing at the second best rate in America. Our COVID-19 positivity rate peaked 15 days ago at 29.98%. It has been rapidly dropping and is now 18%, which is a decline of 40%. Our positivity rate is lower than 42 other states. Our case rate peaked 12 days ago and has already declined by 44%, making it now lower than 47 other states. Both our case rate and positivity rate are declining among all age groups. Hospitalizations in Maryland peaked on January 11th at 3,462 COVID hospitalizations. And after 8 consecutive days of decline, we are now down to 2,983. This is the first time we have been below 3,000 hospitalizations since January 2nd. Our public health team is encouraged by the fact that this decline in hospitalizations is both a result of a decline in admissions and an increase in discharges. We're getting folks healthier and out of the hospital faster. Pediatric hospitalizations continue to make up only roughly 1% of our hospitalizations. And we've reached the point at some of our hospital systems where they are placing adult patients in pediatric beds because of the excess capacity. One point I do want to make is that deaths are always a lagging indicator, usually a couple weeks behind cases and hospitalizations. So, unfortunately, we do anticipate the number of deaths to continue to rise in the short term before peaking and then also beginning to decline, along with all of the other metrics. Sadly, the vast majority of deaths continue to be people who are unvaccinated, which is why we're continuing to urge Marylanders to get vaccinated or to get boosted as soon as possible. Fortunately, Maryland remains one of the most vaccinated states in America. We have now administered over 10.8 million vaccines. And after declaring a state of emergency just 15 days ago, our daily vaccination rate has increased by 60%. As of today, 93.9% of Maryland adults have gotten vaccinated. We are also now approaching 40% of 5 to 11-year-olds who have been vaccinated, which is also one of the highest rates in the country. We continue to encourage parents to consider getting their school-age children vaccinated in order to stop needless quarantines and so the local school systems can continue to keep our kids in school. All of this progress is very encouraging, but we're not out of the woods. Even though we have been able to attain considerable drops in the metrics, and they're continuing to drop, they're still much higher than they had been or where we need to be. So we will continue taking actions every single day to combat this surge. This Omicron variant is 4 to 5 times more transmissible than Delta and the other previous variants of the virus, and Omicron remains the predominant strain here in the state of Maryland. According to the latest data, Omicron accounts for more than 95% of our state's recent lab-confirmed COVID-19 cases. In the past couple of weeks, we have opened 18 new state testing sites to help ease the burden on hospitals and emergency rooms. And today, I'm pleased to announce that our 19th site is now operational at LifeBridge Health in Carroll County. A new site at Greater Baltimore Medical Center in Baltimore County is on track to open tomorrow. And our one federally supported site at St. Agnes Hospital in Baltimore is on track to open Saturday. As of today, we have conducted 17.4 million tests, and we're still testing at one of the highest levels in the country, more than 55,000 tests per day. In addition to standing up new testing sites, we also continue to work on emergency procurements to secure as many at-home rapid tests as possible. Late Friday, we were surprised and frustrated to learn from our vendors that the pending orders for more rapid tests were suddenly frozen for this week. That was after the White House announced their plan to acquire 500 million rapid tests. On Tuesday, during a call between the White House and the nation's governors, I raised this issue with the White House and asked them to work to address this matter. Yesterday, I spoke with Jeff Zients in the White House. He is the White House Coronavirus Response Coordinator. Subsequently, our team had several discussions with Tom Inglesby, the senior White House official in charge of testing. And late last night, we were notified that one of our previous orders of 800,000 tests, which had been cut in half on Friday, is now going to be restored in full. And we hope to make progress with the other providers as well. So I want to thank the White House for taking steps to try to resolve this problem, and we look forward to getting more tests out to the community in the coming weeks. We're also in the process of distributing 20 million N95 and KN95 masks all across the state. We're coordinating with the Maryland Department of Education to distribute 3 million additional KN95 masks to schools, and we have already distributed 250,000 masks to the judiciary. These masks provide multiple levels of additional infection protection compared to cloth and general use face masks. N95 and KN95 masks are now available free of charge through local health departments and at all state-run testing and vaccination sites all across the state. The Vaccine Equity Task Force is partnering with community organizations to distribute them in hard-to-reach and in underserved communities. And N95 masks are being distributed to all nursing homes across the state. I want to thank Marylanders for heeding the call of public health officials. Without any mask mandate, we're ranked number 5 in the nation for the percentage of mask usage, meaning we're better than 45 other states. It continues to be one of the best mitigation strategies we have. In addition to the $100 million we already recently provided to our hospitals and nursing homes, today we are also providing an additional $5 million to specialty hospitals which receive COVID-19 patients who are being discharged from acute hospitals to assist them with their recent extraordinary labor costs. This includes Shepherd Pratt, Kennedy Krieger Institute, Mount Washington Pediatric, Adventist Healthcare Rehabilitation, and Encompass Health Rehabilitation. In addition, I have authorized Brigadier General Adam Flash of the Maryland National Guard to be activated and to serve as a dual status commander for a Department of Defense mission to support the Washington Adventist alternate care site. On Monday, we will be introducing the Healthcare Heroes Act, which is emergency legislation that will codify some of the actions that we have taken to address workforce shortages at healthcare facilities, expediting licenses for retired healthcare practitioners, practitioners licensed in other states, and nursing graduates. These are some of a number of early actions we took on an emergency basis, which made a real difference on the front lines, and making them permanent, a permanent part of the law of the land, will help us to be better prepared for any future crisis. We're continuing to take aggressive actions to protect our most vulnerable residents in nursing homes. National Guard has now delivered courses of remdesivir to all institutional pharmacies that serve nursing homes. A health department order requiring testing takes effect tomorrow, which will apply to all nursing home staff, volunteers, and visitors. In August, we launched an antibody testing program in our nursing homes, which found that more than 60% had demonstrated some waning immunity. That resulted in us taking action to become the first state in the country to move forward on booster shots for seniors in congregate settings. With all of the delays and the confusing and conflicting federal guidance surrounding booster shot eligibility, it was one of the most important decisions we made during the entire pandemic. And while the booster has proven to be effective against the Omicron variant, we don't want to take anything for granted. So this week, in partnership with the University of Maryland Medical System and Johns Hopkins University, we are launching another round of antibody testing in our nursing homes, which we expect to be completed in 2 weeks. This study will help determine whether we move forward with a potential 4th dose for some of our most vulnerable residents. We hope that won't be necessary, but we will be prepared to take action if it is deemed necessary. In closing, we're very encouraged by our substantially improving situation, but the next 10 days to 2 weeks are really going to be critical. So our aggressive efforts will continue, and we ask Marylanders to continue to remain vigilant and to keep doing the things that can keep us safe. Wearing a mask, avoiding crowds, watching your distance, staying home if you feel sick, and most importantly, getting tested, getting vaccinated, and getting boosted. As the battle continues against this virus, I just want to once again thank all of our amazing healthcare heroes for their tireless efforts to care for patients and to save lives. And I want to thank the people of our state for remaining Maryland strong. With that, I'd be happy to take some questions.
Governor, you described the COVID deaths as a lagging metric. At what point are you all projecting that peak to happen and it start to subside?
Do you want to take a shot at that one, Ted? It's like typically, the cases come a week or two later is hospitalizations, and then a couple of weeks later is deaths because they lag. Is that about
7 to 10 days?
7 to 10 days. Okay. We're watching it every single day. It's basically staying around the same level, and we're hoping to see that drop off just like we did in the other metrics. Tom?
Governor, good afternoon. Pediatric hospitalization rates are low. However, in the state's highest jurisdiction, Montgomery County, they just had 16 schools go all virtual for the next 2 weeks. It's a different situation than we faced early on in the pandemic, but how concerned are you right now about what's going on in these schools that is leading to these transfers back to virtual? Is that a step backwards?
It's a mistake, I think, on the part of the local jurisdictions. Look, our kids have suffered enough. They've been out of school for far too long. We want to make sure that we're keeping our kids safe. We currently have 30 kids in the hospital out of nearly 3,000. To shut down entire, school systems or, multiple schools with thousands of kids having to go through remote learning with all the damage that that's caused over the past year is just kind of too aggressive of an action that we don't think is necessary. I know in particular Montgomery County, our health department has reached out to them to try to clarify some confusion that they have and to try to let them know what guidance we think they should be following, as opposed to the actions that they have been taking.
Governor, regarding the antibody testing, under what circumstances would the state authorize a fourth dose, and could that come as soon as 2 weeks when the study is complete?
You know, the last time we decided it was necessary because, you know, we started vaccinating our nursing homes, you know, well more than a year ago, end of December of 20. And so by the time we got further along, after 5 or 6 months, you start to see some waning immunity. With our most vulnerable folks, it had been, in some cases, 9, 10, 12 months since they got vaccinated. And the federal government had been talking about potentially third doses, but we didn't have time to wait because we had people dying in our nursing homes and being hospitalized. So we moved forward ahead of the federal government on the third dose, just for those vulnerable patients. I think the federal government is talking about those things now, and we hope that they'll make a decision on it. But if we believe that it's necessary to save lives in our nursing homes, we'll move forward with a fourth dose without the federal government.
Do you plan on extending your emergency order?
At this point, we're watching it day to day because of the rapidly declining numbers. I'm hopeful that another 15 days and we will be in a position where we don't need to extend the state of emergency.
Dr. Hogan, in that line of questioning, there were projections that hospitalizations could reach 5,000. I know they're well on the decline compared to what they were before. Are officials still projecting that the next couple of weeks will be as challenging as you thought they would initially be?
Well, no. The good news is that, look, they've been really accurate on all of their projections throughout the entire crisis. And they had been saying that they thought the peak was going to be around 3,500. That's where it actually looks like it may turn out to be. But when Omicron first broke out, the numbers started shooting straight up. And that's where they kind of revised their predictions and said it could go as high as 5,000. And it appears as if we are not going to get to that level because we're starting to see all the numbers come down because of all the actions we've taken, because of the great work of our healthcare workers. I think we're going to dodge the bullet on that one. And we don't anticipate, at least with this current variant and this current surge, that we're going to reach that peak. We think it's going to keep coming down. That's what we're hopeful.
Are we still anticipating this higher impact time period until the middle of February?
This higher than normal time period? That's a great question. As I said, we've dropped 40%, 44%. It went straight up like this. It's now, I don't know if you saw, the charts it's crested and it's coming down. If it continues in that direction, we'll be at, it won't be wiped out, but it'll be at very manageable numbers. And that's what we believe, and we're hopeful that will happen.
Governor Hogan, could you weigh in on the litigation to get a restraining order, an injunction against this county's, the Anne Arundel County's mask mandate? It was put in place by a state employee, the state health officer. The plaintiffs claim he doesn't have the authority to do that, but your administration, I thought that was how this whole thing was designed, so that municipalities can make their own decisions. Can you weigh in on where your administration stands on that?
Well, the law grants local jurisdictions the authority to make some of those decisions themselves, and that's the way we've been throughout the entire pandemic for now nearly 2 years. In Anne Arundel, it seemed like there was a conflict between, so they had the right to make their own decision, but there was a conflict between the county executive who wanted to do one thing and the county council who did another thing. The health officers, reports to the county executive and is hired for, technically they work under the state health department's auspices, but does not work for us. I think, somebody took the thing to court challenging whether the county executive had the authority to overrule the county council or that the health officer could. And I think that there was a case heard today, I'm not sure. Some kind of action took place in the Anne Arundel County courts today. I think it expires next Friday, so I'm not sure, whether the court system is backed up as they are, they're ever going to reach a decision before the thing is over with anyway. And I think Anne Arundel County already said they were not going to extend it past Friday. Anybody else? Sure.
Governor, on Monday, your new colleague in Virginia, Governor Glenn Youngkin, told the General Assembly in Richmond that he wanted them to alter a baseball stadium authority to concentrate on building a football stadium. As we know, the Washington football team currently plays its games in Maryland, but we haven't heard much about where the state of Maryland is right now in retaining this team. So as the interest in this has been stirred up again, could you give us any viewpoint as to, is Maryland still in this? Are you still fighting for this stadium or interested in it at least?
Look, we've been working together with the Washington football team for more than 7 years. The team reached out to us before I even became governor, and we sat down with them. We worked with them on finding a site on the Potomac and right across from National Harbor, which Prince George's County then opposed and was back to the drawing board. We've been working in conjunction with Prince George's County, who we and the county would both like them to stay in the state. I've had discussions. Our team has been working together, Prince George's County, state officials working together with the representatives of the team. I've personally talked with the owners of the team and the leaders of the team, and we're very interested in keeping them, but it's kind of the same situation we've been in for 7 or 8 years. They're looking to decide where they're going to be in 7 years or so, and Maryland's going to fight. I'm sure Virginia and D.C. are going to be in the mix too. They just haven't made any decisions.
Governor, this is the second time that
I think that was the last question she said, but I'll let you squeak one in.
This is the second time that COVID has hit your house in
Yeah.
particular in less than a month. That's been a reality for a lot of
Yes.
families for the last 2 years. It's particularly tough to live in the same home with other people who are trying to isolate and continue what they need to do. How has that been for you and your family?
Well, it's, I think, much more difficult for most people. Thank you for the concern, but it is what everybody's going through. I mean, people come, they've got their spouse and their kids or other people. They're living in a house, and trying to isolate and keep everybody safe is really hard. On the one hand, we're lucky because the governor's mansion is a pretty big place to spread out. I know my wife had me locked in a room for 10 days and was dropping food outside the door. Now I'm doing the same thing for her. But she is isolating, and we're trying to keep everybody safe. But it's a struggle. I mean, we've had nearly 900,000 people have been infected. Luckily, most of them don't get seriously ill enough to go in the hospital. But it's still a dangerous thing. And so, even if you're not symptomatic, making sure you're not passing it on to other people is critically important. That's why, even though I've got 2 negative tests, and I'm still wearing the mask while I'm talking to you here today, because that's what the protocol is. And I'm going to, I'm going to try to stay away from the First Lady, except to drop some food outside the door. Thank you.
Thank you, Governor.